Good afternoon, and thank you for joining us for today's webinar on falls prevention. My name is Rachel Logan, the Training and Technical Assistance Manager at the National Center for Health and the Aging. Today we are joined by Lisa Shields, David Dowler, and Robin Lee. At the National Center for Health and the Aging, we are supported in part by a cooperative agreement from HRSA to provide free forms of training and technical assistance to health center programs serving older adult populations. We do this in various ways, including events such as today's webinar. After the webinar, attendees will be able to recognize the increasing burden falls have on the U.S. older adult population, identify the CDC's older adult falls prevention program and resource materials, as well as be able to describe the state of Oregon's efforts to incorporate falls prevention into health systems. Our first presenter today is Robin Lee, and she leads the Home and Recreation Team at the Centers for Disease Control and Prevention's Injury Center. Dr. Lee is an epidemiologist by training and has worked at the CDC for 12 years. Her expertise lies in epidemiological methods with experience in environmental health and injury prevention. Then the next presentation will be by Lisa Shields and David Dowler. Lisa Shields is the Senior Falls Prevention Program Coordinator for the Injury and Violence Prevention Program at Oregon Health Authority Public Health Division. Her experience includes 15 years in project management, research protocol development, and healthcare quality improvement, including falls prevention in acute care. David has a PhD in health behavior and health education from the University of Michigan School of Public Health and an MS in science education from the University of Iowa. He has worked since 1997 as a research scientist with program design and evaluation services for the Oregon Health Authority Interagency Research and Evaluation Group. So I will now go ahead and turn the presentation over to Robin and remind all attendees that the recording will be available after the webinar.
Yeah. Hello. Good morning. I just want to start off by saying thank you to the organizers for inviting me to speak today. As Rachel mentioned, I'm Robin Lee with the Centers for Disease Control and Prevention, and I just enlarged my slides for you. Okay. And I'm giving you a brief overview of the work that we do here at CDC on preventing older adult falls through clinical and community-based programs. To start, I will speak briefly on the burden and the impact of falls, and then I will speak more specifically on our CDC's fall prevention strategy. So to begin, about 1/3, or between 30 and 35% of older adults, these are people who are 65 and older, fall each year. And those who fall are 2 to 3 times more likely to fall again. And 1 in 5 falls causes a serious injury that, such as a fracture or a head trauma. And these types of injuries can result in reduced mobility or loss of independence. This bar chart shows the leading causes of death from injuries for people 65 and older. Overall, there are more than 41,000 older people who die from all types of unintentional injuries, and just over half of those are deaths related to falls specifically. What's really troubling is that the fall death rates for older adults are on the rise. This graph shows the fall death rates from 2000 to 2010, which is the most recent data that we have available. You can see rates for men are in green, and for women they're in purple. After taking age into account, we see that rates increased 64% for men and 84% for women over this decade. So the question is, why is this? Well, we know that our population is aging, and people are living longer. Because of this, they're more likely to be living with a chronic disease. So diseases such as diabetes or arthritis, they can make a person more frail and more likely to suffer a severe fall that might result in death. Another factor maybe that's contributing to these increases is that there is more use of anticoagulants. So if someone falls and hits their head, they might have a bleed in the skull that's undetected, and that could also cause death. Now this figure is looking at the non-fatal injuries that are treated in emergency departments. Overall, there are about 3.7 million older adults treated in emergency departments annually. And you can see that falls are the leading cause of these emergency department visits. Falls also have an enormous economic impact. After adjusting for inflation, the direct medical costs of fall injuries for people 65 and over total $30 billion annually, and most of these costs are due to non-fatal injuries specifically. So I talked a little bit about the burden and the impact, and I'm going to talk more about CDC's strategy for how do we prevent older adult falls. And our strategy is multifaceted and integrates evidence-based programming and interventions that are known to reduce either fall-related injuries, hospitalizations, or functional decline. First, we're going to talk about empowering older adults to change their own behavior and social environment. Second, we're educating caregivers as they play an important role in empowering older adults. And third, we're working to create and support community resources. And then lastly, we'll look at our clinical interventions. And we'll talk specifically about each one of these. So CDC aims to empower older adults by educating them on key risk factors, as well as giving them information and to allow them to make changes within their environment. We have a number of educational brochures, such as the two that are on the screen here. These brochures educate adults on falls, what they can do to prevent falls, and how they can make simple home safety modifications to reduce their fall risk. Things that they can do in the home are simple, like removing aerial rugs, improving lighting so that they see better, and installing grip bars around showers and other areas of the bathroom. We also encourage adults to have their vision screened annually and to wear the appropriate eyewear to reduce fall risk. We also encourage older adults to participate in evidence-based fall prevention programs. These are specifically exercise programs that can improve their strength and balance. And we'll talk a little bit more about exercise programs as we continue. Moving on to educating caregivers. Caregivers have been effective in delaying or preventing the use of nursing homes, Medicare services, and reducing overall medical costs. So we feel caregivers have a very effective role in encouraging older adults to accept as well as to adopt different fall prevention activities. Community health workers have been associated with improved health care access, health and screening-related behaviors, as well as reduced health care costs. So here we're researching how we can utilize health care workers to enable or support older adults in talking about fall risk with their primary care providers. That third bullet I had under CDC strategy was implementing community-based resources. So I mentioned that we're empowering older adults to partake in evidence-based exercise programs. But of course, you can't encourage older adults to participate in these types of programs if they don't exist. So here we have two resources that we offer to aid communities in implementing these types of evidence-based community programs. The Compendium of Effective Interventions is designed for public health practitioners and community-based organizations. It's to help them address the problem of falls among older adults. It describes 22 scientifically tested and proven interventions, and it provides relevant details on how these interventions can be implemented to provide fall prevention programs. There are three types of fall prevention programs that are mentioned. These are exercise-based programs that have information on home modifications, and then there's this multifaceted group which includes a variety of different techniques such as education and exercise combined. The other resource that's on the screen is the Preventing Falls, How to Develop Community-Based Fall Prevention Programs for Older Adults document. This is a how-to guide, and it's designed for community-based organizations who are interested in developing their own effective fall prevention program. The guide is designed to be a practical tool that provides information on program planning, development, implementation, and then how to evaluate programs that are implemented. So there's a number of interventions in the compendium that have been translated into community-based programs. Some can be held in group settings, and there's others that can be delivered at home. One example is Tai Chi. Tai Chi tailored for older adults, that's taken 2 times or more a week and conducted for 50 more hours has been shown to reduce muscle weakness, gait, and balance problems. These are all risk factors for falls. So CDC partnered with the YMCA to build the WISE capacity to effectively disseminate an evidence-based Tai Chi program, and that program was called Tai Chi Moving for Better Balance. And the program was licensed by the Y and includes a Train the Trainer guide and an instructor manual. And these specifications all meet the Y specifications, but don't compromise the actual fidelity of that original program that was found to reduce falls. So to date with the WISE program, we have 10 faculty master trainers. These are individuals who can train other Tai Chi instructors. And we have 300 Tai Chi instructors now trained who are offering classes at WISE and other community organizations throughout the United States. And next, I'm going to discuss more of how CDC is supporting clinical interventions. So based on the American and British Geriatric Society's clinical practice guideline, I'm going to refer to it as AGF, we created a product called STEADI. STEADI stands for Stopping Elderly Accidents, Deaths, and Injuries, and it's a toolkit of resources for primary care providers who want to assess their patients' fall risk. When I refer to assessment, I'm talking about simple things that they can do to assess fall risk, like taking a history of falls, assessing a patient's gait and balance, maybe reviewing the medications they take. It might include evaluating neurologic or cardiovascular function or checking blood pressure, things like that. In developing STEADI, we first looked at the literature to get a better understanding for what healthcare providers knew about falls and what their priorities were in addressing fall risk factors. We found that most providers didn't identify falls or gait disorders as a priority, nor did they evaluate patients who reported falling. Only 37% of older adults in primary care settings were asked about a fall, and only 8% of primary care physicians used any sort of clinical guideline to assess falls. That said, there was a lot of interest by providers to learn more about fall risk assessment and risk reduction. So after looking at the literature, we conducted our own individualized 90-minute telephone interviews with primary care physicians, nurses, and nurse practitioners. We asked them about their thoughts about the importance of falls and whether they were familiar with the AGS clinical guidelines for fall prevention. And from these interviews, we learned that providers were aware of falls as a serious threat to their patients, but only a couple of people were actually familiar with clinical guidelines such as the AGS guidelines. They also lacked information about standardized assessment methods that they could use to address fall risk within the clinical practice. There was also limited knowledge about evidence-based fall prevention strategies. They tended to be more reactive rather than proactive in addressing falls, and they asked us for materials that they could use so they could share with their patients. They wanted these materials to be direct and concise, easy to read. For example, providers wanted information about fall risk factors, assessment tests, and tools, and they also wanted information on how to start conversations with their patients about falls. So STEADI is based on this flow chart, which incorporates the AGS guideline for clinical practice. In the very top, the very first step, is for a patient to complete the Stay Independent brochure. And this here is a picture of that brochure. It was developed and validated by Lawrence Rubenstein with partial funding from CDC. It asks patients 12 questions that focus on the leading fall risk factors. A positive answer to the question is worth 1 or 2 points, and then a score is tallied based on these responses that allows the provider to further determine what the patient's fall risk is and what type of assessment might be needed. This is a survey that can be done by an older adult themselves while they wait in the waiting room. The toolkit also has a number of provider resources, such as these 3 fact sheets. Each links back to the flow chart and is responsive to the provider interviews that we conducted. And topics include things like burden of falls, medications that are linked to falls, and fall risk factors. There are 3 case studies that illustrate patients with low, medium, and high fall risk. This was something that was specifically appealing to some of the physicians that we spoke with. And we have a resource called Talking About Fall Prevention with Your Patients. And this incorporates the stages of change model and gives real-world examples of patient-provider exchanges at each stage in the model. It also offers possible responses that a provider could use based on frequently heard questions or statements that they might get from their patient about falls. We also include directions on 3 standardized and validated gait, strength, and balance assessments. They include the 30-second chair stand, the 4-stage balance test, and the tug, which is that timed up and go test. Wouldn't expect all of these tests or even all of the resources that I've mentioned to be used necessarily in one visit, but they're provided as an aid to the provider in summarizing the patient's fall risk. Folks often ask how long does this take, and I think it really depends on the individual's health and the patient's health and the risk factors that they have. It could be very quick based on that Stay Independent brochure. It could take a second visit depending on the number of risk factors that individual has. And finishing up, research tells us that it's important to integrate different intervention strategies. So we're working to integrate both clinical fall risk assessments with community fall prevention programs. We want providers to know about community-based programs, such as the exercise programs, and be able to refer their at-risk patients to these programs. In a few minutes, my colleagues in Oregon are going to talk to you a little bit about some of the work that they're doing just at that, which is integrating clinical and community-based programming. Before I end, though, I do want to give you the web address that you can use to download the materials that I've talked about today. All of the study materials are free of charge and can be downloaded from this website. There's also a limited number of hard copies. I will say that we have a very hard time keeping them in stock, so they do fly off our shelves pretty quick. They may or may not be there for you, but there are some available. And I also wanted to mention that while not included in the presentation, CDC is currently investigating how we can incentivize healthcare providers who adopt fall prevention strategies, such as STEADI. For example, CDC obtained approval to offer family and internal medicine physicians who use STEADI credits towards their board recertification through their respective maintenance of certification programs. These programs are linked to CMS's physician quality reporting system. Most of us know this is PQRS. And the PQRS system provides clinicians with incentive payments. We're also exploring the creation of an EHR clinical decision support model that could be used with multiple different EHR vendors that would aid in the administration of fall assessments. And we're also developing an online continuing education course that will train providers, NDs, PTs, nurses, and the full gamut of different types of healthcare providers on STEADI as well. And I'd be remiss to not mention the falls team. These are the folks who are actually doing the work on a day-to-day basis. And I also have my email address on this slide for questions that we don't have time to address on today's webinar. And that's it. That's all I have for today.
All right, thanks very much, and welcome to everyone out there. This is David Dowler, and Lisa Shields and I will kind of go through more specific information within our state that we are doing as part of a CDC 3-state grant program. So what we're going to go over today is a similar information that we heard from Robin about the burden of senior falls, but this will be Oregon specific, and then talk about a bit of an overview of how the CDC program has been set up to help the states. And then more specifically, we'll go through sort of our sustainability plan. And within that it is integrating the clinical initiatives with the community-based programs. But we want to highlight the collaboration with the health systems for this talk. So when you look at the problem in Oregon, it's very similar to what there's nothing that much different in Oregon in compared to the national data. It's the leading cause of hospitalization, and it's also the leading cause for both fatal and non-fatal injuries for seniors. And there's more hospitalizations due to falls than for most of the other usual suspects. And even if you combine all of those, and so it's the major problem with hospitalizations. And also, as you saw on the slide from the CDC, I thought it was interesting that it's gone up so much since 2000. It's gone up in Oregon about twofold since 2000. And then again, the charges, the costs of falls has also been increasing, and it's about $200 million per year here in Oregon. Compare that to the $30 billion annually that Robin told us about. And also the rate of falls are much higher for those. It increases exponentially as you get older, and so for those 85 and older, you got a 26 times greater fall rate than those from the 65 to 74-year-olds. So this is a problem that, you take that information, and you can see how that could be a growing problem as our population ages. Here's a quick look at how the fall rates and the hospitalization rates compared to the other types of injuries. And this slide points out that when you're younger and you're in the 21 to 40, that's when the motor vehicle occupant injuries are the leading causes of trauma. But when you finally get into the 50s and then up, especially in the 70s, that's when falls really take over as the leading mechanism of injury. And then also the importance of head injuries, and the major cause of head injuries is also falls. And this slide is showing just the frequency of death among patients in our Oregon trauma system, and also the cause of that injury. And so you can again see that, looking at everyone, that falls are still by far the leading mechanism for frequency of death. And all of those last slides were talking about sort of an interaction with either the hospitals or doctors and clinicians, and how that gets reported in the trauma system. But another way of finding out what's really happening in the community, since so much might not be reported through the trauma system or through clinical services, is by acting on the behavioral risk factor surveillance system. There's telephone calls that happen all the time, and so we find out the number in the community. And so there will be about 1 in 5 of those 65 and over are experiencing a fall within the last 3 months. So of course, over a course of a year, I think it's been estimated about 1 in 3 have a fall, and then a third of those falls lead to some kind of injury. I learned from Robin's slide that 1 in 5 leads to a serious injury. And so this is kind of giving you an idea of the total number that's happening in the community too. Sort of another way to look to find out information about falls and falls frequencies. So leading up to the background for the CDC initiative to have a grants program was finding out that a multifaceted community-based falls reduction program, and that includes work with medical groups and clinicians and the community, can reduce falls. And they found evidence that this could be as much as 10% in this community that was one of the targeted initiatives that started this. And so this kind of became the model for the CDC State Fall Prevention Program. So this slide kind of gives an overview, kind of a model or a picture of how it happens. You have a systems change strategies, and that is being done across 3 state health departments for 5 years. And the idea is to combine the changes in clinical care through STEADI and have this interaction by building community programs and building an infrastructure for 3 different programs. One is the Tai Chi Moving for Better Balance, the YMCA Moving for Better Balance that Robin was talking about. And there's also a Stepping On Fall Prevention Program and an Otago exercise program. Tai Chi is done over a 24-week period, 2 times a week. Stepping On is 7 weeks, once a week, and this is done kind of in clinical settings where the Tai Chi seems well suited for fitness centers or YMCA. And the Otago exercise program happens over a longer period, and it's for homebound, more frail elderly who are visited by nurses and PTs. And so they provide this kind of, 3 different community programs, gives that sort of choice, and also covers the different range of kind of mobility and frailty in the elderly. And here's a slide that's showing a bit how the CDC has set up the evaluation for this, just to know that they were collecting data from participants who were part of the community classes, and also collecting information from each of the sites. And also from the STEADI intervention, there was baseline data and then follow-up data taken by surveys with clinicians, and also key informant interviews and focus groups, and reviews of medical records to check on the evidence of changes in screening and referrals. And in the population data, we want to look at that sort of over the long term and see if there's changes in the total population. We're starting to roll this out, going past the first sort of pilot phase, which was done a little bit closer to the Portland, Oregon area, and kind of spreading it out now to across health systems and across the state. And we're hoping that we can, over time, see some of the changes with death certificate data for falls, and especially hospitalization for falls, and that behavioral risk factor surveillance system, those questions about having fallen in the last 3 months. Another data we're looking at is tracking costs, and then wanting to figure out ways that we can assess whether changes are happening sort of at the policy levels with the health systems and the health plans. But I would like to turn it over to Alicia Shields, who's the coordinator for the State Falls Prevention Program.
Thank you, David. This slide shows you a snapshot of what we're working towards with preventing senior falls in Oregon. And we are about halfway through this grant-funded project. And in order to create sustainability, we realized that the key is really to work with health systems. And so really our #1 priority is collaborating with health systems, and also leveraging health system transformation, which is currently underway in Oregon, and I'll be telling you more about. Working on clinician education referrals to these community programs through the STEADI toolkit. Also pursuing health plan coverage of falls prevention interventions, and getting community health workers and volunteers trained in these evidence-based programs, and improving public awareness of falls as a preventable public health issue, and also collaborating with aging services and professional organizations. So I will be talking in a little more detail about all of these topics. Now, when we look at public health partnering with health systems, we have found, we're 2.5 years into this project right now. Nothing is more important than getting the right champions. And so by working with geriatrics as well as primary care, quality improvement teams, physical and occupational therapists, outpatient rehabilitation, and inpatient falls prevention teams, as well as emergency department and trauma services, we have found that we've been able to tailor our work to align with these business models in individual health systems. So when I'm talking about all of these programs and the STEADI toolkit, please know that those are considered to be a menu of interventions to choose from. And as I talk about these different health systems we're working with, they have each picked different aspects of STEADI or different aspects of community referrals and community programs in order to fit their goals. Right now, working on senior falls prevention in healthcare is very timely because there are lots of different incentives and motivators. As I'm sure you're aware, those of you on the call, we have the Welcome to Medicare visit as well as the annual wellness visit, both of which require a falls screen. So STEADI is designed to really fill that gap by providing a standardized tool. Robin mentioned the physician quality reporting system, and we have found that not only primary care and geriatrics clinicians can participate in this, but also physical therapy clinics. And so we do have some physical therapy clinics doing full STEADI implementation, which I will talk about because they also participate in PQRS. And so the Falls quality measure for PQRS is easily met through STEADI. Also, Oregon has 480 recognized patient-centered primary care homes. Patient-centered primary care homes are a big piece of health transformation in our state because coordinated care organizations, that's what we call them in Oregon. I know in other states they can be called accountable care organizations or ACOs. Coordinated care organizations are required to work with patient-centered primary care homes. Right now, these CCOs serve 90% of Oregon Medicaid members, and we're doing a lot of work with them for falls prevention. And also, Oregon is one of 7 state markets participating in the Comprehensive Primary Care Initiative. We have 67 clinics, and STEADI is a way to meet that falls quality measure as well. And then, as Robin mentioned, we have the American Board of Internal Medicine and the American Board of Family Medicine maintenance of certification credits. So the STEADI Toolkit Quality Improvement Project is a way for clinicians to meet that quality improvement incentive, and we're able to provide technical assistance and verification for clinicians wanting to receive those credits. So there are lots of reasons to participate in falls prevention. This just shows you what health system transformation looks like in Oregon at the moment. It's to meet the triple aim, which is better health, better care, and lower costs. It's about coordinating care at the patient and financing level. It integrates public, physical, mental, and dental health. It's all about measuring performance, engaging people in their own health, paying for outcomes, not activities, and also providing clear and transparent information. So all of that leads to the coordinated care model, and this shows you the pieces of the puzzle, such as best practices to manage and coordinate care, shared responsibility for health, measuring performance, paying for outcomes and health, and providing transparency and clear information. We are collaborating with CCOs by helping them achieve their performance metrics for falls prevention. So when we look at what coordinated care organizations are, we see, again, they're networks of physical, mental, and dental health care providers for Medicaid. They're required to work with those patient-centered primary care homes. We currently have 15 CCOs in operation in the state. There's a focus on prevention and wellness and also being responsive to the community. What we have been able to help CCOs do so far is to provide technical assistance for STEADI implementation as a way to meet quality and incentive measures. We have offered free trainings for CCO staff in Tai Chi, moving for better balance, as well as stepping on and using STEADI materials. And some of the performance metrics for falls prevention in coordinated care organizations are related to ambulatory care and ED utilization, preventive services, medical services, quality improvement, and also comprehensive health assessment and intervention. So all of these metrics can be met by improving falls prevention strategies. This shows you our major health system partners in addition to CCOs. As you can see, Oregon Health and Science University houses many of our important partners, including the Oregon Geriatric Education Center, the Rural Practice-Based Research Center, our Oregon Area Health Education Center is housed there, as well as the Prevention Research Center, and Think First Oregon, which works on preventing traumatic brain injury in seniors. They also host a Matter of Balance classes, and they are a Level 1 trauma center. The other Level 1 trauma center in the state is at Legacy Health System. This shows you a snapshot. They have several hospitals, lots of primary care clinics. Providence Health and Services is a very large health system partner for us. They are in 5 states, 32 hospitals, lots of clinics. They also have senior housing. They are a Medicare 5-star Advantage plan. And the other Medicare 5-star plan in the Portland area is at Kaiser Permanente. They include outpatient clinics, dental offices, and a major hospital. And then we have collaborated with the Portland VA Medical Center. Portland VA Medical Center includes a hospital in Southwest Washington and also 9 outpatient clinics in Oregon. the VA is doing a lot of innovative work around falls prevention, including having a full falls clinic for patients, meaning if a patient is flagged at fall risk, they then come back and have a full workup for falls together with PT. And these are our Oregon Community Health Centers. We have 32 recognized community health centers in Oregon, and 25 of those are federally qualified health centers. And we've been able to collaborate with these federally qualified health centers by offering technical assistance for STEADI, training staff and community health workers in Tai Chi Moving for Better Balance and stepping on and assisting them with community outreach. We went to Medford, where one of those qualified health centers is called La Clinica, and we trained their staff in Tai Chi. We gave them STEADI patient education material. We had the Stay Independent brochure, which is that self-assessment for fall risk for patients translated to Spanish, and we were able to provide that to the clinic. OHSU, the Oregon Health and Science University, has a federally qualified health center, which is the Richmond Family Medicine Clinic, and we are in talks to have that be a STEADI site as well. And then we also have the Multnomah County Health Department. They are a co-sponsor with us for lots of events, lots of outreach events, including senior centers and a Tai Chi flash mob, which we'll talk about, and county commissioner proclamations, lots of outreach events. And then also the Lincoln County Health Center has us staff a table at their county fair. So there are lots of different ways we can collaborate with these community health centers. And this shows you what we have done so far with STEADI in clinical settings. In primary care, we have OHSU. We started with just geriatrics within internal medicine, and now it's being expanded to internal medicine and family medicine. CCOs, which I talked about, that serve the Medicaid population, but also include health plans and Medicare plans. And STEADI is being expanded to rural areas in Oregon through the Oregon Geriatric Education Center, which is housed at OHSU, and also the Rural Practice-Based Research Network. The Portland VA Medical Center is a STEADI site. They've just submitted to IRB to get approval for that, as well as Providence Health and Services. We're also implementing STEADI in physical therapy clinics. Therapeutic Associates is a very large chain of physical therapy clinics. 2 of their clinics here in Oregon have been piloting full STEADI, including visual acuity and medication review and orthostatic measures. That we're finding that physical therapists can easily do all of the STEADI toolkit in that setting. And ways we've been able to help primary care and physical therapy deliver STEADI has been providing technical assistance, print material as needed, minor supplies. When I say minor supplies, I mean things like a wall clock or a vision chart, things like that. Also, we are the state verifiers for those board credits for maintenance and certification. We also house interns here at the Public Health Division. We recruit and supervise graduate interns in order to help STEADI in these settings, and that has been very valuable, I believe, for clinicians. Free labor is always good. Also, we can provide technical assistance for modifying the electronic health record. We assist with institutional review board submissions as required. We assist with data collection and evaluation, and also surveillance. As you saw, we had some of those data slides at the beginning, and we are always happy to provide statewide data to health systems. And the STEADI toolkit is, there are pieces of it, such as the patient education material, that are appropriate in many settings outside of the clinic. Things such as that Stay Independent risk assessment, that self-risk assessment, the Check for Safety brochure. We actually have distributed these brochures at lots of outreach events. We have self-management classes such as Living Well with Chronic Disease and Tomando Control. We give these brochures to instructors. We also give these brochures to Tai Chi instructors. We put them out at Parks and Rec centers, fitness centers, senior centers. We keep them stocked with these brochures as a way to link people to programs. Our next plan is to work with first responders throughout the state to distribute this patient education material as well as class listings. We maintain a list of these evidence-based falls prevention programs on the state public health website, and I'll give you a link at the end. Also, this is a snapshot of a chair rise exercise handout that is part of the STEADI toolkit, and we hand that out at lots of events as well. This shows you the programs that we are promoting through health systems. We have Stepping On, which is a very nice fit in healthcare settings because it follows a model similar to diabetes education or tobacco cessation. It's a group education class that comes to meet in a conference room. They learn exercises. They practice the exercises at home, and it's a group discussion format. It's hosted at these clinic sites because one of the requirements for Stepping On is that guest speakers come to the class, such as a pharmacist, an ophthalmologist. A physical therapist must fit participants with ankle weights and teach them the exercises. So because it's a rather resource-intensive class, it's best held at health systems, in our opinion. Tai Chi Moving for Better Balance needs to be taught for at least 12 weeks, twice a week. And we have been working on getting referrals to Tai Chi classes through STEADI. We've trained over 300 instructors since 2011. We have lots of health system staff trained in Tai Chi, although most of the Tai Chi classes are delivered in fitness centers, parks and rec centers, community centers, and senior centers. But we've trained lots of community health workers, such as Promotores de Salud and parish nurses, self-management leaders, Native American elders, and we actually have Tai Chi Moving for Better Balance happening through the Department of Corrections. We trained Department of Corrections staff in Tai Chi, and it's now taking place at 2 of our state prisons, not just for fall risk, but for inmates as a way to, it's mindful movement to manage stress. And Tai Chi Moving for Better Balance has been offered at the VA here in Oregon since 2009 through the chronic pain and PTSD programs. So they don't offer it just for seniors. It's not because the evidence shows that Tai Chi is beneficial for other things besides fall prevention. And then we have the Otago Exercise Program. This is a program for homebound seniors or more frail seniors that's delivered in the home by a physical therapist. And we have one physical therapy agency delivering Otago right now, and they do take referrals from our STEADI site. And then this shows you our website, healthoregon.org/fall prevention. We maintain a class listing on there of these 3 programs, including any Tai Chi or Qigong class geared to seniors. And we have also included a matter of balance and fall-proof classes in this class listing. And we're finding that maintaining this list of classes is very important because clinicians and the public really do need a central place to find where these classes are taking place. And so our program assistant, Joe Patton, updates that website constantly, making sure that these classes are still running and open to the public. Something we've worked towards in Oregon is health plan coverage of these, of Tai Chi and Stepping On. We've worked with Medicare beneficiary fitness programs, Silver and Fit and Silver Sneakers. Both of these programs are national. They have great websites, and you can look them up in your state to see where they are, which participating health plans they work with. But both of them have approved Tai Chi Moving for Better Balance for their list of approved programming. So we're working with them in different ways through health systems to include that Silver and Fit and Silver Sneakers benefit and link people to Tai Chi. Also, the Providence Health Plan is going to be covering Stepping On as a member benefit. Also, the Portland VA Medical Center has waived the copay for veterans to take Stepping On classes, so that is a fully covered benefit for vets. And then one of our CCOs in Oregon, Intercommunity CCO, has a health plan called SAM Health. They have a Medicare beneficiary fitness program called SAM Fit, and we will be training their staff in Tai Chi Moving for Better Balance. So there are lots of different ways to get these programs covered through health plans. One of the big factors in the success of health transformation in Oregon is working with community health workers and volunteers. And so we are going to pilot a falls curriculum for community health workers and promotores this spring through Metropolitan Family Service. That is a curriculum developed in North Carolina and I believe Texas A&M. We're going to help them pilot and evaluate this, and we have trained lots of community health workers and volunteers in Tai Chi moving for better balance, as well as stepping on. We're going to pilot a Spanish version of stepping on for the Wisconsin Institute of Healthy Aging this spring, I believe. It's called Pisando Fuerte. We'll be doing that with Promotores de Salud. And then we also provide STEADI patient education material for these community health workers as requested. We also go to lots of community outreach events when we're invited. We provide lots of trainings and presentations. And then this just gives you a little list of some of our community health workers that we've specifically worked on with falls interventions and then volunteer programs that we work with. This is a snapshot of our aging services and professional organizations that we collaborate with. What we've been able to provide with these aging services and professional organizations is collaborating in a policy work group. We covered some instructor time for Portland Parks and Recs for Tai Chi moving for better balance. We've trained lots of Tai Chi instructors for them. Again, we provide STEADI material. We list these partners on our website, and we come to their events with exhibit tables. And again, we help provide surveillance and data. And then for public awareness, we have our website, which I mentioned, which besides those program class listings, we have lots of detailed information about the programs and instructor resources, data, latest news. And we also are linked to the State Aging and Disability Resource Connection website. The programs are searchable by county. Every year we participate in Falls Prevention Awareness Day. This year, last year, 2013, we held a Tai Chi flash mob. It was a lot of fun. I'll show you pictures of that afterwards. We issued a press release. We participated in the Public Health Twitter and Facebook pages. We obtained governor's proclamations and county proclamations about Falls Prevention Awareness Day and month. And we did lots of presentations and screenings at senior centers throughout September where we distributed that STEADI material. We do take hospital discharge data and look at fall hospitalization rates. And this fall prevention program began in 2011, and we're starting to see a promising trend. But over time, we'll definitely have a better picture of what's going on. But that just shows you what's happening in 3 older adult age groups from 2000 to 2012. And here are some pictures. We had that Tai Chi flash mob downtown. This is a senior center seated exercise demo. This was at Africa House. These were immigrants. We had our falls presentation translated into 4 languages simultaneously. It was great fun. This shows you our Tai Chi master leader, Suman Barkas, leading Multnomah County commissioners in some Tai Chi. This is the county where Portland is. And this is our contact information. Absolutely feel free to email us if you would like more details or if you would like to ask us for more information. We're always happy to provide that. And that's it.
Okay. Thank you so much. Thank you so much to all of our presenters for the comprehensive information on falls prevention. We'll go ahead and open up for our question and answer portion right now. So if you would like to ask any of the presenters a question, please type it into your chat box to the right of your toolbar. And in the meantime, while we're waiting for questions to kind of compile in the queue, I just have a few brief announcements to make. As I mentioned before, the recording and the PowerPoint slides will be sent to all attendees after the webinar and posted to our website as well at healthandaging.org. Here are some additional resources that we compiled along with all the ones the CDC and Oregon or OHA presented. So please check those out for more research, for more resources. Feel free to contact us or visit our webpage to get more information on some of the free training and technical assistance we provide through fact sheets, webinars, monographs, toolkits, different things that can assist you. Also consider joining our mailing list because we send out updates and information that are pertinent to your population that you're serving, so check back for those. And follow us on Twitter. We do update our Twitter account very frequently. Follow us and get information and updates through that way, as well as check out our YouTube channel because we post a lot of our webinars and other videos that you can use. In addition to forms of training and technical assistance such as this, we also have an annual symposium, and it will be held this year in Alexandria, Virginia. The theme this year is Cornerstones for Improving Senior Health Outcomes, Outreach, Enrollment, and Community Partnerships. So we really want to focus on community partnerships and all the ways we can continue to engage older adult populations. Here's our contact information, and please feel free to contact us for anything you need to help manage your health center or to engage older adult populations or for research and data, as well as contact any of our presenters. They left their contact information, and that's available to you. So opening up for questions, one of the first questions is, how does the state of Oregon allot funds for falls prevention? What are the ways that you prioritize how you allot funds?
Hi, this is Lisa. Well, we are lucky to be a grantee state, so we are funded by CDC. And the way we allot funds is we do have some small contracts with health systems. For health systems who wanted help getting Stepping On started, we did small contracts with them, I think $6,000 per year. We also contract with a Tai Chi master leader to train new instructors, and we contract with a Stepping On master leader to train new Stepping On leaders. And we also allot funds for my position and the program assistant Joe, so that funds FTE, as well as evaluation FTE, David Dowler. That's also, we do pay to include those falls questions in the behavioral risk factor surveillance survey. Those are the big categories, and we do allot some funds to actually buy some equipment, like for example a pallet of ankle weights. It's a little bit expensive, and we keep those around to help motivate Stepping On and Otago instructors. If we provide free ankle weights, because those aren't reimbursed by Medicare, it helps them deliver those programs without too much burden.
Excellent. Good. And then on the flip side, how are health centers receiving reimbursement for falls prevention programs? So you mentioned some in the state of Oregon, but does Medicare pay for falls prevention programs and services?
Medicare does pay for Otago exercise program. Medicare Part B is delivered by a physical therapist in the home. And then, as I said, Medicare beneficiary fitness programs will pay for programs taking place at their facilities, at their fitness facilities, such as Tai Chi. And then for clinicians participating in PQRS, they are incentivized by Medicare to be paid for fall screens.
Okay.
And if I miss anything, Robin can fill in.
No, I think you captured it, the PQRS being the main one, I think, right now for most.
Okay. And then why do older adults fall? Is it because they're tripping, or is it more of what are the other issues that would cause an older adult to fall?
Well, there are a lot of different risk factors. In the home, things like tripping, I mentioned removing aerial rugs. Those things can definitely happen. It might just be poor lighting. They're not seeing where they're going. Often it's balance issues and not having the strength in order to keep themselves from falling when they are walking. There's a lot of issues. There's also medication issues and concern about multiple medications that could make someone more dizzy and more likely to fall. So there's a huge array of different risk factors. We find that improving strength and balance is one of the most important things that an older adult can do, which is why the exercise programs are so valuable. And having your vision checked annually is also important because not being able to see well is a large risk factor for fall.
Okay, thank you. And someone wanted to know, since you mentioned educating or having programs for primary care physicians, how do we educate them, or how do we make falls prevention a priority in primary care?
How do we make falls a priority among primary care? Was that the question?
Yes, yes.
Well, I definitely think it's part of it as educating. I think falls are as the population continues to age, we're seeing more and more. We're seeing the rates increase, and the burden is just so high, both economically as well as to the individuals themselves. Falls these severe falls are causing individuals to not be able to live independent lives. So I think as most providers want to make sure that their patients can live independent and have good quality lives. And so I think most providers are interested in helping their patients and are probably interested in falls. I think they just don't always have the right tools and resources to be able to address fall prevention with their patients. And so I think that's what we're doing, is educating them and providing them the resources that they need to be able to address falls.
Also just facilitating it at the health system level. If you can change policy and then something makes it easier for the provider to do what they want to do, but now they have some help doing it because there's a system set up. So I think that's part of it too.
Right.
Yeah.
And one thing. Sorry, go ahead.
Oh, I was just going to say, I guess that leads me into the next question then. What incentives is CDC looking to implement to get healthcare providers to start, asking these questions and monitoring and prioritizing falls prevention?
Well, the incentives, we mentioned the PQRS program as an important incentive, and the ABIM, the American Board of Internal Medicine and Family Medicine Board recertification. We think that those provide incentives to providers. And then also, I think other things that we can do, such to make it easier to do fall risk assessment, such as having an EHR module, an electronic health records module that would help not only provide some education for the providers, but help prompt them that they should have the patient fill out a stay independent brochure based on the patient's age, or prompt them about different, the TUG test or the stand up and go test, things that they could do in the office to quickly assess the patient's risk. I think that EHR module will help facilitate a more consistent fall risk assessment process for the provider. So those are some of the things that we're doing. Also, the online training course would provide continuing education credits to providers to help educate them on things like the STEADI toolkit.
Excellent. Yeah, that definitely answered one of the other questions that we had. And for the last question, if an older adult is not responding to the falls prevention, like therapies and Tai Chi, what is the next step? Should they be recommended to have a cane or a walker? I mean, how does that work?
I think that's a question that would an individual's medical provider would really have to address with a patient directly. That sounds like a very individualized question, I think.
Okay. So I would just like to thank all of you for joining us today for the falls prevention webinar and giving us the tools and resources to start implementing programs and tapping into maybe what our state has to offer and different things like that to use to really improve the lives of millions of older adults who are suffering from this issue. So please feel free to contact any other presenters as well as anyone at the National Center for Health and the Aging. And thank you again to all of our attendees and our presenters.
Thank you.
All right, bye.